channel. Today I'll be talking about pharmacodynamics and pharmacokinetics, only the core practical tips. Before we start off, I would like to talk about three main concepts that we need to understand before we delve into the topic of pharmacodynamics. The three most important core concepts include that one, fat is non-polar, water is polar. Repeat after me. Fat is not polar, water is polar. Fat is non-polar, water is polar. Don't forget this topic. Secondly, I would like to also mention that for all main purposes, entire organs of the body, all the cells have a lipid bilayer membrane. This is the second core concept. And third core concept involves fat likes fat, water likes water. They don't intermingle, and fat doesn't like water, water doesn't like fat. And always remember that whenever we give any fat product in terms of medication, the fat always goes into the liver for metabolism, and water soluble medicine always goes into the kidney for metabolism. So three most important concepts that I don't want you to forget is fat is non-polar, water is polar. All cells of the body have lipid bilayer membrane for all practical purposes, and fat likes fat, water likes water. Fat metabolizes in the liver, water metabolizes in the kidney. So let me just take an example about a patient who has been given a drug A. Begin with an example of a patient who has been given drug A. Whenever we identify a particular drug and prescribe a medication to a patient, we need to first know whether it is a fat soluble or a water soluble drug. Simple. How do we know it? Go back into your Medscape or certain pharmacological textbooks or Google and identify how long that the drug works, i.e. the half-life. So once you know the half-life of a drug, so for all practical purposes in this lecture, we will assume that anything that has a half-life of more than 12 hours is considered to have a longer duration, and anything that has half-life of 12 hours will help you to retrospectively identify whether this medication is a fat-soluble drug or a water-soluble drug. So let us take an example. I have taken a drug A and I want to know whether it is fat-soluble or a water-soluble drug. What would I do? I would like to find out the half-life of the drug. So once I find out the half-life of the drug, let us assume that the half-life of the drug is 13 hours or 14 hours. And if the half-life of the drug is high, then I know retrospectively that it tends to stay in the body for long. And if it is trying to stay in the body for long, that means it is distributed throughout the body equally and tries to stay inside the body and refuses to come out of the cell and likes to stay in these cells of the body, which implies that this drug enters very easily and stays inside the cell for long but refuses to come out, hence giving it a longer half-life. Are you trying to get it? The same thing, the same concept let us apply to the water-soluble drug. Whenever I look into the water-soluble drug, whenever I look at a drug, I would like to see the half-life. So let us begin with that concept. So let us say that the half-life of a drug is maybe 6 hours. So for all practical purposes, anything that is more than 12 hours is considered to have a longer duration. Anything that is less than 12 is short duration. So a drug that has a 6 hours half-life, retrospectively, if you think, go back and see whether it tries to stay in the body for long or not, we know that since it's actually having a half-life of 6 hours, it doesn't stay in the body for long. It stays outside the cells, and hence this drug is most likely going to be a water soluble because it doesn't enter the bilayer membrane easily, as easy as fat soluble drug. So to summarize, fat soluble drug enters the bilayer membrane easily, stays inside the cell for long, providing it a longer half-life, and gets metabolized in liver, as we have already mentioned. Now let us put the same concept for water soluble, and there are certain and majority of the water soluble drugs, they don't enter lipid bilayer as easy as fat soluble medications, and they don't stay inside the cell for long. They quickly come out of the cell and they get metabolized in the kidney, as we have already mentioned. So always do not forget these three core concepts. Fat is non-polar, water is polar. All the concepts include that. The broad concept include all the organs of the body have cells that have lipid bilayer, and fat likes fat, water likes water. Fat and water don't mix. Fat gets metabolized in the liver, water gets metabolized in the kidney. To keep things clear, I have made a table for you guys so that you can summarize the entire talk and the concept that we have discussed so far. So dividing the drugs into polar and non-polar. Non-polar being fat soluble and polar being water soluble medication. So entry into the bilayer membrane of the cell. It's easy for fat soluble medications, but it's relatively difficult for water soluble medications. Coming to the length of stay inside the cell, it is usually longer because half-life is longer for fat soluble drugs, and it is usually shorter for water soluble drugs. And metabolism takes place in the liver for fat soluble drugs and in the kidney for water soluble drugs. So you may think retrospectively that if a particular drug gets metabolized in the liver, you would definitely want to know the liver status of a patient. So there are certain medications which you need to know whether the liver functions are good or bad before starting a particular medication. So now you know that if at all you would want to start a medication, which medication needs an LFT prior to starting. And similarly, whenever we are trying to start a water soluble drug for a patient, we know that the end result is that it gets metabolized in the kidney, and it helps us in identifying certain patients in whom we would like to get a kidney function test in terms of serum creatinine and a creatinine clearance before we start these medications. So this is an extra pearl that I would like you to carry out. I would like you to take out from this lecture. Now, you may think, what is all this that he's trying to say? Entry into the bilayer, staying inside the cell for long, water likes water, fat likes fat, and he's not at all using any technical jargon. He's not at all being out technical. He's not using pharmacological terms. So yeah, for those guys who would want me to use technical jargon, uh, non-polar drugs enters the lipid bilayer easily or crosses the lipid bilayer easily. It has a higher volume of distribution. As we know, higher volume of distribution means it gets distributed equally and very nicely throughout the body because it fits non-polarity, that is, it is fat soluble, hence stays in the body for long, providing it a higher bioavailability and at the same time longer half-life, and ultimately gets metabolized in the liver, which is nothing but cytochrome P450. Lastly, I would like to also mention regarding the knowledge about side effects. I usually had this difficulty whenever I used to work in wards, which medicines usually caused what side effects. I always had to look up in Medscape or in textbooks, Katzang or KD Tripathi, to know which drugs actually needed dose titration for patients who had kidney failure, and which drugs usually required dose titration who had liver failure, and which drugs usually caused side effects, what side effects. So for all general purposes, always remember a broad outline out of this concept that we have already talked about. We can also identify certain side effects of any medication that we come across in our day-to-day life. So whenever we talk about side effects in fat soluble drugs, we all know fat can go anywhere in the body because throughout the body there is a lot of cells which have lipid bilayer membrane, and this fat soluble drug can cross through lipid bilayer membrane anywhere easily without any difficulty. So you may ask, does it go to the brain? Yes, it can go to the brain. The fat soluble medications can cross the blood brain barrier. Yes, definitely. The endothelial cells of the blood brain barrier have lipid bilayer membrane, and fat soluble drugs can easily pass through them. Does it cross through skin? Yes, it can go to the skin. Muscles? Yes. Pancreas? Definitely. Any other organs? Yes. So coming to the side effects of these fat soluble vitamins, it is relatively easy to understand. Can these fat soluble vitamins cause dementia, dizziness, confusion, altered mental status? Yes, definitely, because it can cross through the blood-brain barrier. It can cross through the blood-brain barrier, hence causing dizziness, confusion, altered mental status, dementia. Can it cause dermatitis, erythema, rash on the skin? Yes, it can. Can these medications cause muscle spasms, muscle pain, chronic muscle pain, chronic muscle spasms, tendinitis? Yes. Which are those medications which can cause chronic muscle pain, chronic muscle spasms? Put it on the comment so that we can discuss. There are certain medications. I would like to give an example of a fluoroquinolone, statins. These are certain examples of those side effects which are involving chronic muscle spasms and muscle pain. Can these drugs go into the pancreas? Yes. It can cause pancreatitis. It can cause pancreatic edema. Whenever we are talking about any drug, and in specifically the water-soluble drug, we always know that these water-soluble drug usually goes into the kidneys for metabolism. So always try to analyze beforehand, before we start the medication, whether this patient requires dose titration before we start water-soluble medication, because as we all know, dose titration is always needed for patients who are suffering from kidney failure, chronic kidney disease, and such patients always require a prior serum creatinine or a creatinine clearance before we start these water-soluble medications. So the concept is very simple. Whenever we are talking about lipid-soluble drugs, fat-soluble drugs, we need to make sure that the prior LFT is being done before we start fat-soluble drugs. And before we start water-soluble drugs, always make sure that the creatinine clearance and the creatinine levels are being taken beforehand before we start the water-soluble medications. As simple as that. So you don't have to keep on going back and looking back into the textbooks or Medscape to identify which drugs require dose titration for chronic kidney disease patients and which drug requires dose titration for liver failure patients. You just have to know which drug is water soluble, which drug is fat soluble, and retrospectively you can come to know by just looking at the half-life of the drug that you are trying to use. As simple as that. Okay guys, I think this helped you in getting a little bit of concept as to how to go around reading pharmacology and pharmacodynamics from the textbooks. There is a lot more to learn in pharmacodynamics, but I feel the core concepts mainly revolves around these three concepts that we have discussed today in this lecture. And if you do like the lectures, then we'll be coming out with more and more lectures soon. So subscribe and comment below if you liked the class. Thank you so much for watching. Stay safe. Bye bye.